some scientists have compared circadian disruption to smoking or to obesity in terms of public health. That's quite a grand statement to make or to hear. So do you think our modern light environment, bright nights, dark days, is really that dangerous to make that comparison?
Yeah, over a long period of time, it doesn't seem like it does much, in the short run. But over a long period of time, I think we've got some very good research now that absolutely shows that it is deadly in terms of shortening your life. Let's face it, everybody dies at some point. But if you want to extend longevity and you're doing all of these things to extend your life and you're looking at things to extend your life and you completely ignore this circadian issue, you're really shooting yourself in the foot and you're cutting off your nose to spite your face, to quote a well-known saying.
I wonder, is there maybe a person, a case study that comes to mind where you think back to and you think, this is the example in my mind of how powerful light is when it's used in this way or thought of it in this way? Is there a particular person, patient, story you reflect back on and you think, wow, this had a monumental shift in this person's life?
Oh yeah, I mean, I can think of the first first couple of people, patients of mine. I'm a pulmonary and critical care physician, so I see patients in the intensive care unit that are very, very sick. They're on life support. I see patients in the clinic who have issues with their lungs. And I also see patients with sleep disorders too. So that's sort of giving me a little bit of interest as well in circadian rhythms. That's part of what I do as part of my job. But whether we're talking about circadian rhythm, light during the day, darkness at night, whether we're talking about the power of light during the day, not just from a circadian rhythm standpoint where we're fixing the internal clock in our minds, but also the effect of just light on the human body itself, which we'll talk about. There's a number of patients that were doing very poorly in my own care that when I came on and exposed them to light outside, they did much, much better. There's a number of cases that have been told to me of just amazing cases of a 15-year-old boy, for instance, that was dying of a flesh-eating fungus, that they had nothing else left that they could do. And I reviewed those medical records personally. I looked at the CT scans. I talked to his mom, and inexplicably, or more maybe, with an explanation, got better after they took him outside, not because they thought it was going to work, but because that was his last request. So, I understand that there are studies that are very concise and they're very, directed towards these outcomes. But when you actually see it in front of your own eyes in an individual, it's quite powerful.
Yeah, I think it might be quite powerful to circle back on that example you gave there about the boy with the sort of flesh-eating virus, and you said it was his last wish to go outside, right, or something like that, and then that had a dramatic effect on his well-being. In what way did light affect him and his condition?
That's a very good question. We obviously it wasn't tested for, so all we could see was the outcome. But this was a boy who had been in the hospital for 6 weeks after he developed a opportunistic infection. That means an infection that we would normally just kick out without an issue. But because his immune system was weakened because of the chemotherapy from his lymphoblastic lymphoma, he got worse and actually had to have one of his lungs removed, his left lung. And the remaining right lung was getting worse. He was on increasing oxygen supplementation, BiPAP, things of that nature. These are devices that you can wear to help you breathe. And the team approached the family when he was not doing well. His white count was very elevated. That's a sign that the infection is getting the upper hand. And it continued to climb despite being on extremely powerful antifungal medications like, for instance, amphotericin B, posaconazole. These are very powerful antifungal medications. And I looked over the medical records. It's there documented. They had a family discussion. They really had nowhere else to go. They talked about perhaps doing, bronchoscopy or which is a scope that goes down into the lung to see if they could find something there, or taking fluid out from the lung from the side. But none of these were really definitive. There's talk about going on a heart-lung machine, but again, that's a bridge to what, right? So if they're not able to get the fungus under control, then it's really not going to lead anywhere. And so because of that, they made a recommendation not to put him on a ventilator if he were to get worse, but to let him pass away, basically, because they had done everything they possibly could. So it was at that point that they approached the boy and asked him, this is what's going on. They had to explain this to him, first of all. It was very difficult to explain this to a boy who's perfectly conscious, understands what's going on, what the dying process looks like. And they asked him really what it was that he wanted to do in this situation. You can imagine how difficult this is, and how difficult not only for the family, but I relate to the healthcare providers who are doing everything they possibly can, and this is the outcome. This is not the outcome that they wanted to have. The nurses, the doctors, all of that. And he said, "I just want to go outside." And I can tell you, as a physician who's taking care of someone, when you're trying your darndest to try to get them better, and it's not working, and they have a last request, you're going to do everything in your power to do that. And I'll tell you, that's what it took, because this guy was hooked up to machines, oxygen, BiPAP machine, and to get that mobile where you could actually get him outside in that situation required a lot of work to make sure that he could do that. But they did it, and they got him outside. The first day they got him outside, he was about there for about 5 hours in the sun. And over the next, 4 or 5 days, he continued to make improvements steadily. His white blood cell count came down, which was good. His fever went away after the first day, which was good. And by that, they had given him 2 days to live at that point. And when obviously they saw that he was getting better, his oxygen requirements were coming down, his blood cells were coming down, everything was looking better. They decided to do another CAT scan, which is basically a pretty in-depth scan of the lungs, which they had done right before they came to this conclusion, which looked pretty bad. And in just 5 days, there was a dramatic change in something that had been going on for weeks. Lewis, this had been getting worse for weeks slowly, and then to see in just 5 days an immediate retreating of the disease was quite impressive. Quite remarkable, to say the least. Really, the doctors didn't have an explanation for it, but they liked what they were seeing. They allowed him to continue to go outside, and good news is that he got better. His fungal infection, as shown months later on a CT scan, was completely gone, and he was able to even continue the treatment for the leukemia. So that was probably, out of all of the experiences that I've ever seen, the most dramatic. Now, granted, this guy was young; he was 15. He has a great immune system, and if given the opportunity, those immune cells are going to do what they need to do. We've got a lot of research now on the benchtop and observationally that shows that light from the sun, which is what he was experiencing, penetrates deeply into the body. Glenn Jeffrey out of University College London just published a paper last month in Nature Scientific Reports. It was a major journal showing and demonstrating that sunlight literally penetrates through our body and can be detected on the other side, obviously in much smaller amounts. And he was able to show in these subjects that light was actually doing something to the mitochondria, not just in the path of the light, but also in distal aspects away from that light. So we know that sunlight is not just for the skin. It is actually for the whole body. There is a physiological, constitutional change that occurs within minutes, within probably 15 to 20 minutes, based on the research that Glenn Jeffrey has shared in the mitochondria, that can have a dramatic impact. And if those mitochondria are in immune cells, those immune cells are going to improve their function. If that's in the lungs, that's going to improve function there. So, this is really a game changer. People who understand the science and are reading this and keeping up to date are seeing this. This is a new field called photobiomodulation, and what we're learning is that light in general, can have these effects systemically on the human body.
What I find astounding, and I was, as you were saying that, I was picturing in my head my local hospital. And whenever I visited the hospital on these wards, you go into these wards where there are, say, 10, 15 beds in a ward, and there's very little windows in the room, right? They're not built in that way with these things in mind, but you'd think they could be built more efficiently to factor things like that. If there is an effect, even a small effect through a window, to build that into these bed-bound wards. So would I be right in thinking, if I was admitted to the hospital tomorrow and I was going to be on a ward, I was going to be bedbound, I'd at least want the bed next to the window.
Yeah. Yeah, and there are literally dozens and dozens of studies. I've looked at this. Whether you're talking about the ambient lighting in the room, whether you're talking about the size of the window, whether you're talking about which bed is closer to the window, whether you're talking about being outside, dozens and dozens of studies all showing that the more light during the day, the bigger the window, the amount of light coming through the window, all have demonstrable physical endpoints that are met, especially in terms of length of stay. So people next to the window are discharged faster from the hospital. And these are in patients, all sorts of patients, not just depressed bipolar patients, but these are patients who have had orthopedic procedures. These are people that have had cardiac bypass. These are all sorts of patients, medical intensive care patients. So there's a wide variety of studies. There's a wide variety of subjects. And we see in various different ways of controlling that the more light people get on their body, the better and the faster they heal. This is not new. This is not a new discovery. Maybe we're getting ahead of ourselves, but in my estimation and probably the world's estimation, the founder of modern nursing, Florence Nightingale, who I'm sure being from the UK you would be very familiar with, saw this back in the 1850s. She was at the bedside. She was next to these patients during the Crimean War, and helping them. She was known as the lady with the lamp. She was literally there, and she was the one that cleaned up these hospitals, got people to wash their hands, started to, improve the sanitary conditions. And she says, out of all of those things, the top two things that she saw that made the biggest difference in whether these patients survived or died was, number one, fresh air. And a very close second to that was light, and not just daylight, but actually direct sunlight, is what she decided to say. Now, these are people without scientific accoutrements. They don't have echocardiography. They don't have labs that we had. This is over 150 years ago. And yet they were able to observe this stark difference between those that were inside, not getting fresh air, not getting to the light, and those that were outside.
Wow. If this has been apparent for so long, why do you think this, light as medicine isn't really talked about in sort of mainstream healthcare? I've never heard a sort of doctor talk about this. I've not seen it on any medical shows. Why is this something that isn't talked about more in the mainstream?
I think it's probably multifactorial. I don't think there's any particular reason for it. I'll tell you, I quote grew up in the medical field thinking that the benefits of the sun was vitamin D, that you could basically summarize the benefits that you get from the sun, other than circadian rhythm, of course, in the eye, but that it was vitamin D. And so, if we could raise the level of vitamin D using medications or supplements, that we could avoid a lot of the pitfalls or the downfalls of sunlight, like skin cancer, by supplementing and avoiding the sun. Well, I was similarly disabused of that notion during COVID when I really had to look into this and see. I'm convinced that the benefits of sunlight is far more than just vitamin D. There are far more benefits. Vitamin D is just one little area that science happened to stumble across and understand. So there's what we're taught. There's also, we don't really in a system where or I should say companies are paid to come up with interventions that they can copyright or patent and then deliver something that I call scientific reductionism, where we see something that seems to work a lot and we try to find the active ingredient, we purify it, we supplement it, and we patent it, and then we sell it in high doses, hoping that it's going to work. In that type of an environment, there's really very little monetary incentive to look at the studies and see, that sunlight is actually beneficial, much less implement it. Nevertheless, we have that data. There's actually plenty of data where they've looked at sunlight and have found this to be the case. So there is that. I wouldn't even say a financial incentive. So let me give you a little bit of an explanation about how healthcare works here in the United States. In most situations. So what we have in most situations, and there are exceptions to this, but when someone purchases medical insurance in the United States, it goes to these very large companies, and they collect the premium. And then what happens is the insurance companies will contract with medical groups and hospitals, providers, to take care of those patients. And here's the key: per member per month. So in other words, you have 100,000 people that they'll contract. They say, hey, we have 100,000 people. We'll pay you this amount of money per member per month to take care of all of their healthcare needs. And so what essentially the insurance company is doing is it's passing the risk on down to the provider. So they are the ones that can, on a very large scale, get these premiums, and then they can limit their liabilities by saying we're going to pass that risk on and only and charge and give away this amount. That's why we can have this amount of profit margin, and it's very stable, and we can, not a lot of liability. That's great for the insurance companies. But then what happens is at the provider level and the hospital level, now what happens is they're incentivized, believe it or not, to actually try to take care of these patients using the least amount of cost possible. So they don't want to be, medical providers and hospitals don't want to be giving them very expensive medications to get them better. They're actually incentivized to find very low cost, cheap, inexpensive ways to try to make them better. So I'm still very bewildered because in that environment, and there's a number of studies that we've just talked about that show that sunlight, we can talk about some of the studies in COVID from Brazil, infrared light, many of these things can really just chop off the number of days that these patients are in the hospital. Yet, even in that kind of an environment, I don't see a huge movement in the hospital industry, in the primary care provider industry to get patients outside. So there must be something other than the issue of incentives. And so the only thing I'm left with is this idea that you and I both know about, that the sun is a deadly laser, and that if you go outside in the sun for too long, you're going to get skin cancer. And people are afraid of the liability from that. There's a gentleman in your country, in the UK, by the name of Richard Weller. He's a dermatologist, well known. He's up at the University of Edinburgh. He just actually published a huge study out of the UK Biobank looking at the effect of solarium use and the effect of short band radiation, basically ultraviolet radiation, in particular areas in the UK. And what he showed was that the more solarium use and the more ultraviolet exposure in a very rational, non-sunburn type of exposure type of way, when they did that, there was a reduction in all-cause mortality, cardiovascular mortality, non-skin cancer mortality, just a reduction. At the same time, there was a slight non-statistically significant trend to increase incidence in melanoma, but absolutely no increased death from melanoma. And I think after that was published, just actually, I think it was last year, he wrote an op-ed and he's a dermatologist, remember. He wrote an op-ed or a review to the prestigious Journal of Investigative Dermatology, where he said, look, maybe it's time for dermatologists to rethink this idea that the sun is a deadly laser and it's just a way of giving you skin cancer. We need to weigh these risks and these benefits and maybe getting outside. So to answer your question is, why is this not being picked up? I think there's multiple reasons. And I think all of those fronts are being appropriately dealt with, I think, as this data is coming out. And when people start to understand what it is that's going on, people start to see that, in fact, we do need to get outside.
Yeah. And just for our audience who, because I don't want to get too far ahead of people right now. So for our audience who are brand new to this topic, they may be thinking, I've only ever thought about light, in terms of vision. So other than vision, what role does light actually play in the human physiology?
Okay, so let's for those who are new, let's go way to the very beginning.
Yeah.
So if we're looking at light coming from the sun, it's extremely important to understand that there are three different types of light that comes from the sun. The first type of light is the light that we all know because we can see it. That's visible light. But believe it or not, that's only about 38% of the energy coming from the sun. Now, on the other side, there is light that is invisible that's beyond the red. We call that infrared. And we experience that light as a feeling of warmth. So if you were to go outside and close your eyes, your skin would be able to feel that infrared light through your clothes deep down into your skin. And so let's just talk about that there for a little bit. Obviously, there's no vision, there's no rods and cones in your skin, yet you're still interacting with that light. And that is because that infrared light from the sun, which is the second type of light that we're talking about, has the ability to penetrate through objects very deeply. It can go very deeply through clothes, very deeply through skin. In fact, as we just discussed with Glenn Jeffries' publication, they've actually detected it going clear through the body, and it's being absorbed and picked up. And the science is now showing that this type of light is very beneficial for mitochondria, which are little organelles. They're like little batteries in each of your cells, except for your red blood cells. But these are like little power packs in your cells. And what we're finding out is that as we get older, these power packs, these batteries, start to drain. They get lower and lower and lower. And what we're seeing here is a mitigation of that overall effect as we get older. And this is amazing. So the other type of light, the third type of light, is also light that we can't see, but it's on the other extreme. It's past violet, and this is ultraviolet. And so this is important light that we need to have as human beings, because this is the type of light that makes vitamin D in our skin. So there are reactions that occur in our skin that convert cholesterol derivatives into vitamin D. And vitamin D obviously has a large role to play in many areas, not just bone and calcium metabolism, which we're all very knowledgeable in medicine, but also immune and a whole host of other things. Vitamin D is a hormone, essentially. It's extremely important. It's a steroid hormone, and it works inside the nucleus of the cell. So vitamin D is important. And so really what we're getting from the sun is three different types of light: visible, number one; invisible ultraviolet, number two; and infrared, and then invisible ultraviolet, number three, which we can't see. Those last two we can't see. So the problem has been is that we really haven't understood the real benefits of infrared light on the human body until just recently, well after, because of the push of energy efficiency, we've surrounded ourselves inside with lighting equipment, processed lighting equipment that is designed to give light just in the visible spectrum. Okay. And as a result of that, for the first time in human history, our bodies are now being exposed to light that is not full biological spectrum. It's now just in the particular spectrum of where the eye can interact. And as a result of that, you can imagine what's happening now. So imagine now a light is going into the eye, okay? And whereas before it was both visible light and invisible infrared light, what was happening? So at the back of your eye is the retina, and the retina has these rods and cones, and the cones specifically are the types of cells that pick up color. And they are extremely highly metabolically active. So this is the tissue in the body with the highest amount of metabolic activity, the highest amount of mitochondria. And that infrared light that was coming in initially when you go outside in a natural environment was nourishing, was making sure that these mitochondria were working effectively. And the visible light was coming in. That's the task that the cones are being asked to do, is to take that visible light, to put it into chemical energy, send a signal back to the brain and say, hey, there's light in this particular area of the retina at this particular wavelength, and then you can see what light is. Now what's happening is we're in artificial environments where we have just the visible light that's now coming into our eye. So you can imagine what's happening. We're basically asking the cones in our retina to make bricks without straw, in other words, okay? We're asking it to translate this visible light. We're tasking it to convert this visible light into chemical energy that our brain can see without giving it the infrared light that would normally be taking care of the mitochondria that's powering this whole deal. So Glenn Jeffries' work not only looked at light penetrating through the whole human body, but in that study, what he showed was that he was able, in natural lighting environments, to improve the visible accuracy of detecting different shades of red, different shades of green, different shades of blue, etc., in that study. showing and demonstrating, and he's done this on multiple occasions in human beings in LED environments, that a wide biological spectrum of light that includes infrared is much better for the nourishment and the distinguishing of colors in the back of the eye.
Do you think it's maybe possible that this modern light environment we have, so too much artificial light at night and
Yeah.
not enough sunlight in the day, as we've touched on there, could that be a major pillar or component in fueling the crisis of the soaring rates of depression and anxiety we've seen over, say, the last 50 years?
I do believe so. And not only that, I think we actually have data that actually demonstrates that. Not only that, but also demonstrates mortality. So there was a study that was done where they fitted everyone with watches with light detectors on it. This was just visible light detectors. And this was a few thousand subjects. And what they did was they followed them for a number of years. I don't remember exactly how many years it was, but what they did was they were able to categorize subjects by the amount of light that was coming to the watch. They had those that were in, the lowest tier of light, those that were in, less than 50%. Then those that were in the 50th to, 95th percentile, and then those that were above 95 percentile. So in other words, at any given hour of the day, they were able to see, based on the entire population, the light that's coming to this watch, where would it place them for that particular hour? Okay. So you can imagine then what they have set up. They have this graph and they showed this and they said, okay, let's look at all of the people for every single hour of the day that had greater than 95% intensity light coming from their watch. And let's look and see what happened at 4 o'clock in the afternoon. And now let's look and see what happened at 5 o'clock and so forth for the entire 24-hour period. This is what they found. This is mortality data. Okay, Lewis, this is quite impressive. Mortality data showed this, that from 4 o'clock to about 9 o'clock at night, those individual subjects who had greater than 95% of the light coming to their watch, in comparison to those that were less than 50%, had significantly reduced mortality after they had followed them for years and years and years. After about 9 o'clock at night, it started to come up, and by about midnight, those that had greater than 95% of the light compared to the population coming to their watch and compared their mortality to those that were getting less than 50%, which is the right thing to do at that time of day. Their mortality, the greater than 95%, went above 1. In other words, the odds ratio went higher than that and stayed high all throughout the night until they got to about 6 o'clock or 7 o'clock in the morning. And then it dropped below 1 again, which means that light is now a benefit, not a harm. And it showed that until about 4 o'clock in the afternoon, it stayed below the threshold of 1. So what does all this data mean? It means very clearly, we could see very granular data, literally by the hour. Bright light into your eyes, is it a benefit and is it a liability? And when does it change from being a benefit to being a liability? And this was incredible data. In fact, it was published in the United States Proceeds of the National Academy of Sciences, and it was entitled. The title of the paper, ironically, was exactly what you just said at the beginning: bright nights and dark days. And so I could give you the study, and you can look it up too. But it confirmed for me that absolutely that this exposure of light in the eyes is at the wrong time of day can have a tremendous negative impact, and the very same exposure at the right time of day not only can have a different effect, it has the opposite effect. So absolutely.
Wow. So this is amazing. So with this in mind, with about the timing of light, I'd love to take the example of someone from my own country, the UK. Okay, so notoriously not the best weather here. We get maybe a couple of weeks in summer where it's quite sunny outside, and I'm from Wales in the UK, which is known to be the part of the UK with the worst weather. So unfortunately for me, I'm in the country with the worst weather inside the UK, which is known for terrible weather. So if you take someone from, say, where I'm from, Wales, and you take a typical office worker, so for the majority of the year, when they leave for work before 9 o'clock, it's dark outside. And by the time they clock out at 5 o'clock, it's dark outside again. So the period of the day where there was the potential to get out in the sun, they've missed it because they've been in a dark office environment. So they're not seeing a lot of sunlight throughout the UK. So what is happening to that person's body and their mental health when they're stuck in that cycle of going to work when it's dark, and by the time I'm coming home, it's dark again?
It's bad. It's very bad. Their circadian rhythm is not being entrained. And not only that, but there's also a part of the brain called the perihabenular nucleus, which requires input from the eyes from bright light to prevent this type of mood disorder, which we call seasonal affective disorder. So you all know that in the wintertime, the sun gets up very late and it goes to bed very early. And just like you say, if your business hours are outside of those times, you could go literally for weeks without seeing the sun. And so, yes, it's wreaking havoc. In fact, Lewis, if you were to look, and this is what I'm about to tell you is mind blowing. So listen carefully. When you look at the mortality data for just about all of the top causes of mortality, so I'm talking about heart disease, I'm talking about cancer, I'm talking about respiratory disease, influenza, kidney disease, mental disorders, all of those things. If you look at those and you look at the day of the year and you track it over several years, you will see the same pattern over and over again. And it's a very large amplitude pattern that you will see. And this is the pattern that you will see. You will see that all of the diseases, infectious diseases, non-infectious diseases, it doesn't matter. Cardiac disease, heart disease, renal disease, influenza, all of these diseases peak in terms of death about 1 to 3 weeks after the shortest day of the year, and which is in December and January, and are at their lowest about this time of year, which is about 1 to 3 weeks after the longest day of the year. And interestingly, if you look at Australia, it's exactly the same pattern, except, of course, it's 6 months off because their shortest day of the year, which is still in the wintertime, is in June and July. But their longest day of the year, which is, again, in the summer, is November and December. So, in fact, I will tell you this. During the flu season, which is around, October to February, March, in that area, there are actually more cardiac deaths. There's a higher amount of cardiac deaths that occur during that time than there are influenza deaths in the entire United States. In fact, Harvard Kennedy School did a study and found that sunlight was very protective of getting influenza based on looking at solar radiation data and CDC data. So this understanding of, yes, this worker who goes to work and doesn't see the sun in the morning and doesn't see the sun in the evening, yes, probably the most likely thing that's going to happen is they're going to become depressed. But realize that a lot of these other diseases become exacerbated. Cancers become exacerbated. Heart disease becomes exacerbated by the fact that of the lack of getting out into daylight and sunlight. Now, you mentioned that you're living in Wales and that there's a lot of cloud cover. There is still going to be much, much more light and infrared light outside of your home, even in those environments, than there would be inside your home. If you have any experience with photography, you'll know that if you set up a camera in a manual mode where you're setting the f-stop and the ISO and the aperture, and you try to take a picture inside and it comes out nice, you take that same camera without making any changes, even on a cloudy day, and you take it outside and take a picture, it's going to be overexposed. And that's because our eyes plays tricks on us, because when we go outside in that environment, our pupils get very, very small, and it has to let in a lot less light because there's so much more light out there. To give you an example, inside your home, we can measure the light intensity in terms of lux. And inside of a home, the lux inside of a home is about 50. If you were to go outside on a bright sunny day, it's about 100,000. Okay, so that just to show you the magnitudes of difference there. On a cloudy day, you're still in the few thousands. So you're getting much, much more light, multiple times more light, even on a cloudy day. So going outside is still beneficial.
And because I see this argument whenever I've watched content talking about sunlight, you see a lot of comments from people in places like Iceland or the Faroe Islands where sunlight is very few and far between, and those people are always looking for alternatives like the SAD lamps.
Correct.
Are things like that a real substitute, or is that sort of just a band-aid for the problem?
Okay, so again, we have to separate what we're talking about. In terms of light exposure to the human body and infrared light, those SAD lamps or SAD lamps will not provide any kind of benefit in that situation. However, if we look at entrainment of the suprachiasmatic nucleus in terms of circadian rhythm, they can actually have in fact, they have shown to be very beneficial. So the time to have light exposure in your eyes to prevent the negative effects of mood disorder and to prevent the negative effects of circadian rhythm disorder is in the morning time, as soon as you get up in the morning. So what I recommend to my patients and what I would recommend to anybody in that type of an environment where they're for weeks or months on end getting up and the sun is not up is to expose your eyes to a 10,000 lux lamp. Those are pretty standard. And to have it about 11 to 16 inches. How much is 11 to 16 inches? About 30 centimeters from the head, and you turn it on for about 20 minutes. We like to see about what we call 3,000 lux hours. We multiply that all together. And if you have a 3,000 lux hour, that's like 3,000 lux for an hour. Hey, but if you have 3 times the power in a 10,000 lux lamp, you can do a third of an hour, which is 20 minutes, and still get the same benefit.
So, why is viewing again sunlight in the eyes in the morning, first thing in the morning, so important? Because I've heard multiple people express this, and I think it's like a catchphrase of Andrew Huberman to say, when you wake up, make a beeline for sunlight. Why is it as soon as you wake up? Why is that important?
It's because that's when the circadian rhythm has pre-programmed us to get that type of light at that time of the day. If we were to get the same type of light in the eyes at a different time of the day, it would have a completely different effect. As we just talked about with that study that we talked about, like light at one part of the day can actually make you live longer. Another part of the day can actually kill you earlier. I mean, it's that dramatic, the difference. The way I try to explain circadian rhythm, and this might make sense. I live in Southern California. We have Disneyland here. And I had a friend in high school that used to work at Disneyland, and he would work at night. He was part of the night crew. And he would tell me all sorts of interesting stories. Like he would ride Space Mountain with the lights on. Normally it's ridden with the lights off. And so it's kind of a different experience. But the part of it that got me really interested was what happens in parks like this when they're trying to turn it over for the next day. I mean, the engineers come in, they shut down the rides, they check for cracks, they, dump the cash registers, they restock the gift shops, the gardeners are out weeding, people are scraping gum off. I mean, it's a complete transformation so that when the park opens the next day, it's a brand new park. Like like it went through so much the day before with like thousands and thousands of visitors that got like entropy increased dramatically, right? Things are out of place. And then what it takes to get all of that back in place so that the next day it's a brand new day and it's ready to do. Disneyland is complicated. We're far more complicated than Disneyland. And the processes that have to occur at night to make sure that the stuff that happened during the day gets, put back so that we can be on our best the next day. There are all those things that have to happen. And here's the key is that these individual processes that are all happening in parallel have to happen when those things are happening. Like for instance, can you imagine if the engineers shut down Space Mountain in the middle of the day? Like that's going to take away from the experience of the park goer. Or if you're going to It's a Small World and the gardeners are out in front weeding the garden, right? That would like Walt Disney would have an aneurysm if he saw that. So all of these specific metabolic processes that are occurring at night typically are happening when you're fasting, typically are occurring when the lights are out, typically are occurring when the hormones that are on the circadian rhythm are at a particular level. And if any of those things are are interrupted. Like if you get light where you shouldn't be getting light, melatonin shuts down. If you eat when you shouldn't be eating, certain metabolic enzymes like cortisol, insulin, glucagon, leptin, those are out of whack. And we know that just staying up for one night doing an all-nighter, for instance, a college student studying for an exam, can affect over 150 different enzymes. And a lot of these enzymes are involved with immunity, with cardiovascular disease, with metabolic health. So yeah, absolutely. When Huberman says that you need to get up in the morning and get light, that's because we know that light at that particular time of day tends to entrain your circadian rhythm, gives you a better cortisol peak, which is what you need in the morning, and sets you up for much better sleep later that night with a much better melatonin secretion, because cortisol secretion in the morning sets up your melatonin secretion right before you go to bed.
Is it possible in any way to out supplement bad light exposure, or is sunlight doing something pills never could?
Yeah, no, there's no way you can really. I mean, people might take melatonin at night, but the problem is that when you take too much melatonin, it actually can make you more irritated, more irritable, like not feel well, like things set you off, that type of thing. What you really want to have at night is low light. After 9 o'clock, shut down lights. You can wear the blue blockers, and the reason why people think that the blue blockers may be helpful is because those receptors in the retina that are picking up the light that is telling the melatonin to shut down is particularly sensitive to blue light. But remember, it's not just blue light. So any kind of light is going to do that. So if I were to say, what's the best situation? It's no light. What's the second best situation? It's anything but blue light. What's the worst situation? Doing nothing. So, if you are going to have to be up and you're going to have to look at light, make sure the light is low down, because the receptors in our eyes are low down and things get flipped when they goes to the back of our retina. So in other words, low light is going to hit the superior retinal fields and not the inferior retinal fields. Make sure that it's red light, because it's less likely to stimulate those receptors. But again, the best situation is exactly the way that human beings have lived forever until the last 100 years, which is darkness at night and brightness during the day.
You mentioned the blue light blocking glasses. Now, when I spoke to Professor Russell Foster from the University of Oxford, he was convinced that there's no hard evidence that they actually do anything for your quality of sleep.
Yeah,
What's your take on that?
yeah, I would tend. There's very soft circumstantial data that seems to indicate that blue blockers may help. But what I believe he's discussing is, do we have randomized clinical controlled trials that show that wearing these glasses improves not only short-term sleep benefits, but also long-term effects? I mean, we have data. This is pretty interesting. Think about this. What's going on here again is light at night is going into the eyes. It's hitting the back of the retina, and it's being transmitted back to the suprachiasmatic nucleus, which processes that data and then tells the pineal gland, turn off the melatonin. Think about this. If we were to sever that nerve, that means you could have as much light in the eye as you wanted, but not in any way decrease melatonin secretion, right? So obviously we would never do that in somebody, because we want to be able to see. But there are people that are blind for that reason. And so what researchers did was they took those people that were totally blind because there was a disconnection from the retina to the brain. And the theory is that melatonin, which is a very powerful antioxidant, mops up a lot of this oxidative stress, prevents the damage of DNA. And so we believe, and we've seen that people who do night shifts, for instance, people who don't do this, they get cancer. And as we just talked about, right, people who have bright light at night, they seem to have a higher risk of dying. So when they looked at these people that were blind because there was no connection, what did they find? A 30% reduction in cancer in those patients. So, that's the kind of endpoints that we're looking at. Do we have endpoint data that shows that wearing blue blocker glasses reduces cancer, reduces these kind of long-term endpoints? Certainly not. And I think that's probably what he's getting at. And so we don't have data. We don't know that.
So when we are we're winding down, we're ready for bed. So was it an hour before bed? You said devices off, lights off, and
Yeah,
for that 1 hour before bed. Yeah.
yeah, yeah. There's a study that looked at somebody looking at a backlit tablet
Hmm.
versus just reading a book that was illuminated by a soft lamp. And just looking at the spectral data of the intensity, the luminosity of that, the backlit book was much higher than the regular paper book that you could read. And when they looked at to see what happened when they decided to go to sleep, I think it was like 26 minutes sleep latency. In other words, it took the person reading the backlit tablet 26 minutes to fall asleep, whereas the one that was reading the book was like 15 minutes. So that's a 10-minute difference. That's pretty significant in sleep data. I mean, imagine if you could fall asleep in 10 to 15 minutes versus 25 minutes, right? That'd be a big difference. And what do we believe is going on there? There's less melatonin, and it's because it's being shut down by that backlit light.
And I think we're moving towards a world now where, you're seeing things like VR headsets, you're seeing kids with 16-hour screen days.
Yeah.
Some people's entire careers are based in virtual reality now, right? People are having meetings with the VR headsets on. Everything they do exists in a virtual world, so the exposure to screen time is going to increase and increase and increase. Do you think human biology, especially our brains, can keep up with this increase in screen time, or are we
We're
on a collision course with ourselves?
we're falling behind already. I mean, the EPA in the United States asked a survey of people probably 10, 15 years ago now, how much time do you spend inside versus outside? It was 93% either inside a house or in a vehicle in the United States. I think there was another study in Great Britain and or the UK, it was 92%. So you guys are a little better. Maybe it's those English gardens that get you outside that we need to have more of. But the point is that we're inside creatures. And I can tell you as a Gen Xer in the United States, the environment that I grew up in personally, and also a lot of the people in my generation, when we got home from school, we played outside. We played with our friends. We played on the streets. Our parents got home at some point at 5 o'clock in the afternoon. I mean, we were latchkey kids, so we had keys in our pockets. We were the first ones home that day, and we would just go outside and play with our friends. We'd meet up. We'd ride our bikes, do whatever, right? And then our parents would get home at 5:36, and here was this call: come home when the street lights come on. That was at 8 o'clock. Didn't leave us a lot of time for homework, especially towards the summer, but that's how we lived. We didn't have, I mean, we had video games, right? But it wasn't like it was just like a hobby that you might have done. It wasn't so involved. And there's just the use of video games today has just exploded. We had Pong, we had Pac-Man. Those are things that we would do on the weekends when we meet up with friends, go to the mall or something like that. But for by and large, most of what we did was play outside. We didn't have phones. And there's been a tremendous shift, not just in terms of kids and how they grow up, but adults and what we need to do. And artificial intelligence, VR, as you mentioned. Even my job as a clinician, I see patients. What do I do? Instead of, it used to be, and I remember this from 20 years ago, I would see a patient in a room. I'd have this manila chart. I would open it up. I would page through. I'd find things. And now everything is me looking at a computer and the patient's kind of sitting off on a bench. And I'm like, occasionally we'll look at them. Now with AI, ironically, that's actually getting a little bit better where I can have a conversation and that can be transported and put into the computer. But yeah, no, I mean, most of our jobs today are looking on a screen, and this, chronic disease, obesity, all of these things are going up. So how much of it is that? How much of it is the diet that we have? It's difficult to tell, but yeah, we're already falling behind.
Do you set any personal rules for yourself and your relationship with screen time?
Yeah, it's difficult. Practice what you preach. I hear that all the time, and it hits me right here because, as an intensive care doctor, somebody's got to cover the night shift, right? These patients die at night. Something's going to happen. You have to be there. I get home late from work. I've got sleep studies I have to read. They're on computers. I have charts that I have to go over. That's on a computer. So I understand it. And am I a 100% compliant with my own recommendations? No, I'll be the first to tell you. There's sometimes where I have to bend those rules. But those rules are there. The rules of health, the laws of health don't care why we break them. There's just consequences. So I have to redouble my efforts. Let's all keep a track of each other here and push. But the bottom line is that we know what the laws are. We can see it. Do we need more research? Probably to further fine tune it. But I think we kind of got an idea of what we need to do. And what we need to do is we need to be in bright days and dark nights.
If we had a scale from sort of 1 to 100% of someone's attention to their light exposure, so 100% being perfect, they've got next to no screen time, they're getting sunlight exposure in the morning, all the great things we've talked about. And then on the other end of the scale, you've got that 9 to 5 worker we talked about in the UK. So for someone to go from a 1% to say, let's say they just improve these things we've talked about today, and they go from a 1% to a 20%, what impact can just that small shift have on them, as opposed to going from one end of the scale to, okay, I've got to go all in on this. This has to be my new obsession?
No, not a lot. Not a lot. People that do these sorts of things can actually see some improvement. I like to put it this way. Imagine that you're a British sailor on a ship 300 years ago, and your gums are bleeding, and you're looking around at your colleagues, and they're just withering away. And the question is, how much of that lemon or that lime do you need to bite into to get enough vitamin D to start seeing a benefit? And when you put yourself in a deficiency situation, small amounts of supplements, supplementing the vitamin is actually going to have a large effect. Here, we're essentially, the lack of infrared light and wide spectrum biological sunlight, the lack of this is the scurvy of the 21st century. We are desperately lacking it. Some people are outside all the time, and they may have other issues. There's other laws of health that they may be violating if they're sick. But if you look at, by and large, the working class of industrialized nations, we get up in the morning, we go to our car, which is in our garage, we drive our car to a parking structure, we go to an office building that is made of glass that has infrared light that blocks it for efficiency, and it's being lit by LED or fluorescent bulbs that have no infrared light. And we work there until the sun goes down, or maybe in the summer the sun is still up and we come outside, we might get a little bit of light there, and we go home, and then we turn on our TVs, turn on our devices, and get more light exactly when we shouldn't be getting light. And then we go to bed. And we do this day in, day out. That is a huge reduction in the amount of infrared light that we are getting as human beings than we used to get just 50 years ago.
So with all that in mind, whether it's to do with screen time, whether it's to do with working hours or our environment, if you could make just one change to how society interacts with light and dark for the sake of both physical and mental health, what change would you make?
So you can't quit your job. You can't change the way that you work. You can't change the hours that you work. So what I've tried to do, and I'm in the same boat. So I go to work at 7 o'clock in the morning and I get out at 7 p.m. And for many months of the year, that's going to be outside of sunlight. That's the shift that I have to do. Now, I don't do that shift every day, but on those days that I do it, I make it a point that on my lunch break or my break, I get outside and I try to get into the sun. If I have a cancellation and I'm in the clinic, I make it a point to getting outside and getting some sunlight, or at least getting outside. I think the key is understanding consciously that we need to find ourselves in the sunlight any opportunity that we can. So if I'm home and I'm reading or doing something, I try to get outside. You don't have to be in direct sunlight. We're not talking about sunburning yourself or being out there hours on time. What we're really looking at, and this is really based on Glenn Jeffrey's work, again, looking at the mitochondria in anything from mosquitoes to fireflies to bees to humans, is about 15 to 20 minutes is what it takes to see changes in the mitochondria that can last for a day or so, or even days. So I think probably the ask here is find a way to get outside for at least 15 to 20 minutes a day, primarily if you can in the morning time. If you can't, at noon. if you're not someone that's used to getting ultraviolet light exposure, which is the highest at noon, then just get outside in the shade and be around green plants, because green plants, greenery is very adept at reflecting infrared light too. So you can be in the shade, but if you're surrounded by green plants, that light from the sun is going to hit the green plants and reflect that infrared light to you. And that's going to be very beneficial. There was a study that was just done where they measured HSCRP levels. That's highly sensitive CRP. It's a surrogate marker for inflammation. Did it in about 745 subjects in South Louisville, Kentucky, very urban environment. And they measured it. And then over 2 to 3 years, they planted about 8,000 trees in this 4 square mile area, and then went back and remeasured the same subjects' HSCRP levels without instituting socioeconomic plans or exercise program or a dietary program. Their HSCRP levels dropped by 13 to 20%, which translated into a stroke reduction of about 10 to 15%. So that's phenomenal. And that's what, not even telling them to get outside. That's just making sure that when they were outside, there were trees that could filter the air. There were trees that were giving off phytoncides and things of that nature, but also, as we just discussed, highly reflective of infrared light.
Well, that gives me hope, because the one thing Wales has going for it is you can't take 2 steps outside your door without being surrounded by greenery. So at least we've got that, right?
Absolutely. I've got my mom's family is from England. I have family there in Bognor in the south. I've been to Wales. I have some great aunts that lived in Wales, and I went to a castle there. I can't remember the castle, but it began with the letter C. It's a famous castle in Wales.
Cardiff Castle?
That it might have been, yes.
Yeah, maybe. But there's lots of castles up in
Yeah, lots of castles.
Oh, amazing. I love it. Well, for everyone listening and watching today, if someone was brand new to this idea and this subject of light today, and they've come in knowing nothing before this conversation, what is the one thing we've talked about today that you'd want those people leave this conversation? If they could only remember one thing, what would you like them to remember?
I would like them to get outside for at least 15 minutes a day. If they're concerned about getting damage of their skin from the sun, wear a broad-rimmed hat, cover up, wear long sleeves. That would be the number one thing I would say, is to get bright days into their body. A close second would be to shut down the lights as much as possible after 9 o'clock. I think if you were to do just those 1 or 2 things, I would be very surprised if they did not notice a dramatic improvement in their well-being and how they slept.
Wow. Amazing. Well, that's very actionable advice. I think everyone listening, watching can take those steps and do that today. So, Roger, thank you so much. The last question we ask every guest, and this is not related to your work or the subject, but we ask it to everyone, whether you're an actor, a sportsman, a scientist, we ask the same question. And that's, right now, for Roger Seheult, what makes life worth living?
Oh, it's having people implement these things and telling me that it's making a change in their life. That really, I don't know, maybe that's why I went into this field, is to make a difference in people's lives, is to give people very inexpensive, actionable, simple things that you might not have thought about that can make a big difference, not only in your life, but in other people's lives. And if I make a difference in your life and you tell 10 people that, and they tell 10 people that, together we'll make a change.
Amazing. Well, you certainly do that, my friend, and you've certainly done that today. So thank you so much for joining us. For everyone listening and watching today, they've enjoyed this conversation. They want to hear more from you. They want to connect with you online. They want to find out more about your work. Where's the best place we can send everyone to right now?
Well, where I put a lot of work in and try to make sure that we have the best data, most evidence, is on our YouTube channel, medcram.com or medcram. And then we have a YouTube channel, we have a website called medcram.com. So that's MED, like medicine, CRAM. So like you're cramming for medicine. And initially it started out as a teaching tool for healthcare providers, but it's expanded into much more than just that.
Yes, and it's an incredible YouTube channel, so I highly recommend it as well. So for everyone watching, just click the description below, and those links will be right there. Roger, thank you so much for joining me today. This hour's flown by. It's been an absolute pleasure to have you on. Glad we could make this happen.
Well, thank you so much, Lewis. It's been a pleasure.